So we call it the classification, because this classification, it helps you when they do a pap smear. Different results you can get when they do a pap smear, and what those results signifies, and what needs to be done, because it's very, very important what needs to be done. Okay. And first of all, what you need to establish is the age we start doing pap smear, because sometimes in the exam they can ask you the age. So we see that from 21 years they have started doing pap smear. I know there are so many school of thought out there. Some people will tell you, what if the person is sexually active? Can you start at 18? But from my own study and what I have learned, it's always important to wait till 21, because that is the when you will get the enough tissue to be able to check what you are doing. So we call it the pap smear result. And what you need to look at in that pap smear result, it is broken down into four. Into four. So we have the normal one, we have the ASCUS US, then we have the low grade squamous intraepithelial lesion, then we have they are into five. Again, let me repeat myself because we have to include the normal one. So if we include the normal, then we include the ASCUS US, we include the low squamous intraepithelial lesion, then we have the ASCUS high, then we have the high. So that ASCUS is your atypical squamous cell. So first of all, this one, two, three, four, five. I always tell people to use your fingers. You have five fingers, five of them. So you can start with your five fingers and use it, or you can draw it in a paper, because, like I said, this is a high yield exam question. You may not understand it one time. It's just something you have to keep um, looking and trying to figure it out how to remember. But one thing you need to remember is that it goes from 21 years to 24. That is when we said we actually start PAP, which is at 21. So just remember, when you start it at 21, so if the person is between 21 to 24 years, if they have a normal pap smear, you can repeat it every 3 years. Every 3 years. But if you see atypical squamous cell of undermined significant, if you see this one, then what that means, if patient is between 21 years to 24 years, you can do the pap smear again in 1 year, which is preferred, or you can do a reflex HPV test, any of these two. But if it is low squamous intraepithelial lesion, low, okay, repeat pap test in 1 year. If it's ASCUS high, I usually say high, but it's not high, it's ASCUS H. But I will tell you why I always use high. Colposcopy. Then HSIL, colposcopy. So one of the secret way to learn this or understand this is all these ones that have H in it, which is ASCUS H. I say H like high. And this one that have HSIL, which is also high. So all these two, it doesn't matter the age. Just know that it is either colposcopy or excisional treatment, because just remember that high is dangerous. So never ignore once it is high. Well, once you see HSCH, once you see that H, just always remember that it is what? It is high, or it is something that you never ignore. So it doesn't matter their age. If you look at it, it doesn't matter their age. What we always do is colposcopy, okay? Colposcopy. But if they are greater than 25 years for high, you see it's excisional, or colposcopy. Just if you bear that in mind, the high or H, I'm saying high because it's how I remember it. But if you have in mind that all the H and H, they are all colposcopy, it doesn't matter the age. At least it will help you to answer any question. Once you see any question, I don't know if I have any question on this. Okay, we will come. Okay, for example, this question now, I don't need to read all these things, but immediately I look at this question, I see H here. I already know it's high. That is the bad one that shouldn't be ignored. So what do I choose immediately? Colposcopy. I don't even need to waste my time in the exam. So that is just what it's telling you. Colposcopy. Once I saw high, it can be ASCUS H, it can be HSIL. Um, I will just choose colposcopy, and that is what you are saying. But the you can do excisional treatment or colposcopy. Okay. Then we have the other two, these two, ASCUS US and low squamous. So in this one, you can also figure it out. Once they are between 21 years to 24 years, you can repeat PAP in 1 year. So both of them is repeat PAP in 1 year, repeat PAP in 1 year. But once patient is 25 years to 29 years, under ASCUS US, you can do PAP in 1 year, but the low squamous interepithelial lesion, colposcopy. Colposcopy. Then there's another thing to remember. There's another thing to remember. If they are greater than 30 years old, and they have a HPV, remember they can do both the PAP and the test. The HPV is negative. That HPV is that thing we said we check for cervical cancer. Okay, so we have a lot of strength, but when you do it and the HPV, that HPV virus, when you do the HPV, and once the HPV, human papilloma virus, that is HPV. So when they do the HPV, there are so many strains of that HPV, but we know the ones that is a higher risk of cancer and the one that is lower. So I can put it for you. This is another topic, we will still see it, but just for emphasis. So we have low risk of HPV. So those strains are like HPV 6 and 11. Okay, those ones are just genital warts. Genital warts. We talked about it in our STD. They are genital warts. But the high risk one, the one that is high risk, they are the 16 and 18. We still have others, but 16 and 18 is the highest risk. And to be honest, this is exam question. They can ask you which strain is the highest for cervical cancer. Then it is 16, 18. Then these ones are there too, but 16 and 18 are the highest one. So anytime you hear about cotexin or reflex texting, that means that it is done with pap smear. Okay, they do both things. So they are doing both things, both the pap smear, and also doing the to checking for the HPV. So if the HPV is high, is negative, sorry, we are talking about negative. If it is negative, you can see, if it is negative, you can repeat co-testing in 3 years. You can repeat PAP in 1 year or preferred or colposcopy. But if it is positive, if that human papilloma virus is positive and the pap smear, if the patient is greater than 30 years of age, 30 years of age, then it is colposcopy. It is colposcopy because it's positive. But if it is a normal pap, let's say they have a normal pap, but their HPV is positive, but it's a normal pap, but the HPV is positive and patient is greater or minus 30 years. What you need to do is co-testing in 1 year. Co-testing in 1 year. So other important points to remember for the exam is for this HPV, they can give them a vaccine, and we know the two vaccine that we use. Vaccination for HPV, we call it a Gardasil and Severus. Gardasil and Severus. So the Gardasil, I always remember it as Garda both boys and girls. Gardasil. But the one for female is Severus. Severus. So you can be asked questions on the vaccination. So the one for the boys is Gardasil, and the one for the boy. And somebody can say, why are they saying vaccine for boys? Yes, the boys do not have cervix, they do not have cervical cancer. Okay, but remember, this is a HP virus. So this can also predispose men to something like anal cancer, perineal cancer, genital warts. Okay, so it's very, very important that you also vaccinate them. So, and they usually start giving them this vaccine from 9 years. Sometimes you see 11 years, but they put it both. So the older versions, sometimes you just remember they give the HPV vaccine. This is the Gardasil G for Garda both boys and girls. So you give it to both the boys and the girls. Then the Severus, I know it's still down in the slide. We'll still have to look at it, but just for your emphasis before we get there. So, and another important thing, like we said, another important thing to remember is that this if they have the HPV, if the HPV is positive, like we said, if it is positive, that means they have a higher risk of cervical dysplasia. They have a higher risk of those cancer. And because they have a higher risk of those cancer, you don't want to wait. You see, if once it is positive, so we are saying once this is positive, as long as they have risk of any of these. So look at it. It can be ASC US, it can be low squamous intraepithelial lesion. As long as any of these four, okay, and patients have positive HPV, you have to do colposcopy. Just think about it, because meaning as long as they have this positive HPV, that means patient is at risk of cancer. And because patient is at risk of cancer, don't choose any option that is saying wait for 3 to 5 years. Wait for, you have to do something immediately. You have to do something immediately. So remember, if HPV, so I'm just giving you just little step to remember, because I know this can be confusing, but go through it again and be able to find how to remember. So if HPV is positive, once you hear that it is positive, okay, it's a high risk. We said it's a high risk of cancer. So that means any of these, any of these here. So do colposcopy. Im- So if you look at it, this colposcopy, you see 1, 2, 3, 4. They are all colposcopy, and the last one is excisional treatment or colposcopy. 1, 2, 3, 4. Because once it is positive, the HPV, we are talking about the HPV. Okay. And there was another thing that I said. Once you see H, like me, I use the word high. So if you see Ascus H or H here, these two, never ignore. Never ignore. They are all colposcopy. For the Ascus H, you see all of them are all colposcopy, and the HSIL, they are all colposcopy or excisional treatment or colposcopy. Okay. Then people that are between 21 to 24, younger people. So these are the younger people. If they are here, except if they have ASCUS high or HSL, is all colposcopy. But if they are here and it's normal, remember we're talking about normal. If it's normal, you can repeat it every 3 years. Every 3 years. Then co-testing. Co-testing means when you hear about co-testing is, for example, here we say co-testing. So co-testing means you are doing both the PAP and the HPV. Both the PAP and the HPV. So if you look at another important thing, when they are below 30 years, there is no HPV. So these two here, there is no HPV. When they started doing the co-testing is when they are greater than 30. So when they are greater than 30, they are doing co-testing. So what is that co-testing? They are doing the HPV and the PAP. So they are doing it every 5 years. Sorry, because you are going to do both. If you don't want to do if you don't want to come every 5 years, you can come every 3 years and just do the PAP. So it's either you ask the patient, do you want me to schedule appointment every 3 years, or for you to come back and do your PAP? Because PAP is every 3 years if it is normal. If it is normal, it's every 3 years. Or do you want to come in 5 years' time so that you can do both the PAP and the HPV, and the patient will let you know what they want to do. But that is how, always remember, always remember, every ASCUS high and every H, all of them, always remember to always do colposcopy. So this is another sample question. We have done the other question, and read the other question and let me know what you think is your answer.